Some 2 million academics and students are either in the process of returning to their campus or waiting to see whether it's safe for them to go back to class. Higher Health has been training management, student support services and other officials on how to deal with the phased-in return of students. Let's have another look at this. Higher Health CEO Dr. Ramnyak Ahluwalia joins me now. Dr. Ahluwalia, good evening to you. Thank you very much indeed for your time. What kind of measures do higher education institutions have to have in place as students return?
Good evening to you and to all the listeners, and thank you very much. We've got in post-school education system about 5 subsectors. The first subsector is universities. We've got TVET colleges. We've got CET colleges, which are community education training colleges. We've got private higher education institutions, and we've also got something called skill-based learning. And each of these institutions have widespread campuses. We've got about 300 campuses just alone in TVET sector. We've got about 1,800 centers just in the CET colleges. And every campus means there are thousands of human lives. And these are students and staff, service providers that are entering our campuses on a daily basis. Now, how do we put a system that applies to everyone, leaves no student behind? And I think that's where the concept of training and development of COVID-19 task teams at every institution level, which is primarily the decision-making body led by a vice chancellor or a CEO or a principal of a college. And under each institution, we have campuses, and we started developing called campus steering committees, which are basically the implementing bodies. And training needs to happen both at the COVID-19 task team level, where the management can take decisions related to, and that's why we had to build guidelines specifically on the PSET system around quarantine, around campuses, around the residence programs, around classrooms, cleaning, disinfection post-COVID-19. You're talking about screening mechanisms, prevention, you put physical isolation, and right from a security, right till a resident or accommodation that we have inside our campuses. And that's where the training at senior management goes, and that's where the training at the implementation level goes, and that's at the campus levels.
There's clearly a lot to be done. Do campuses have to be more careful than, say, your average business, right? You go into a shop at the moment, you get screened, you have your temperature taken, you kind of get used to it, it's daily life. Campuses dealing with young people, physically perhaps stronger in terms of dealing with the virus, not as vulnerable, but packed together, maybe not as adept at social distancing perhaps. So my question would be, are there measures that campuses need to take that businesses don't need to take? In other words, do campuses need to pay more attention to this?
In fact, if you look at the science of this virus, all of us have no immunity to the virus. Irrespective, we are old, we are young, or whoever we are, as long as we are human beings, we have no immunity to the virus. So this means we all are vulnerable, which means whatever applies to a public space, which is in a grocery store, has to apply in any public environment. And in higher education, it becomes more complex because the campus has a lot of young students coming in, staff coming in, service providers. And as per regulation, we have to screen every individual. So we have to find methodologies of how we screen thousands of students coming every day. And that's why as Higher Health, as Department of Higher Education, Post-School Education, we launched using digital application, the fourth industrial revolution, keeping technology in mind. So we with the help of Department of Health and NICD, we developed something called Health Check, which is available on your SMS through a USSD, which is totally free. WhatsApp, you can do it through WhatsApp or through web form. What you can do is in 2 minutes, you will know your status, screening yourself on daily basis, whether you are on high risk, moderate risk, or low risk to COVID-19. And if you are low risk, on your name, you get a certificate with your date and expiry. And if you are on moderate to high risk, automatically you are linked to the tracking and tracing system of the Department of Health. And if people can screen, if students can screen at home in their residences before leaving their home, we can prevent a lot of infection, because if they are moderate to high risk and they don't have a clearance, they should stay at home, because the aim is to isolate people quickly so that they don't spread the virus, they don't infect other people. And that's the whole methodology of how to put prevention.
Dr. Ramnik, we're going to have to leave it there, I'm afraid. Dr. Ramnik Ahluwalia, I really do appreciate the time. Thank you very much indeed. The CEO of Higher Health.